In this video, we'll be discussing about human herpes virus 3, that is herpes zoster virus, also known as varicella zoster virus. So this varicella zoster virus can cause two types of diseases. The one is chickenpox and the other is shingles. Chickenpox in children and shingles in adults. We'll start our discussion with chickenpox first. So this chickenpox has an incubation period of about 2 to 3 weeks. And the rash distribution is bilateral and centripetal. Centripetal means it will start from the trunk and will move to the periphery. Easy to remember, centripetal means chicken pox, CP. And with each crop, the child will have fever. And it can be in the form of macules, papules, pustules, vesicles, or it can be pleomorphic. But if chickenpox occurs in an adult, it will be more severe and it will be in form of hemorrhagic and bullous lesions. Now this dewdrop on a rose petal appearance. This is a classical description of chickenpox rash. Here you can see this vesicle. It is surrounded by erythematous area similar to a dewdrop on a rose petal. Now the period of infectivity. It will be 2 days before and 5 days after the rash. And the immunity will be lifelong. It is no longer considered that the immunity is lifelong. But still it's written in books, so we'll consider that. Now the complications. The most common cutaneous complication will be secondary bacterial skin infection. And the most common extracutaneous complication will be benign cerebral ataxia. Most dangerous complication is a pregnant woman getting varicella pneumonia, which will cause varicella syndrome in child. If the infection will occur within 20 weeks of intrauterine life, then the child will suffer with congenital fetal varicella syndrome. And if the mother has varicella late in her pregnancy, then the child will suffer with neonatal varicella syndrome. As you can see here, the child has everything small: the microcephaly, cortical atrophy, limb hypoplasia, and cicatricial skin lesions. In neonatal varicella syndrome, the maximum chance of transmission is 5 days before to 2 days after delivery. And it is a disseminated disease. And we can take PCR from skin lesions. Disseminated disease means it will cause new organs affected. Now about the treatment. If the child does not have lesion, still we'll give the child acyclovir prophylactically. But if the skin lesions appear, then we'll give varicella zoster immunoglobulin. And is there any vaccine? So yes, there is a vaccine of Oka strain. And we'll give 2 doses of this Oka strain vaccine. Now starting with shingles. So if someone had varicella in his childhood, then sometimes this virus go and hide himself in dorsal root ganglia of spinal cord and can cause reactivation in adult stage due to old age or any immune deficiency. And the rash distribution is unilateral and segmental. Segmental because it is most common in segments of the dermatome D3 to L2, and it is painful. Now, if the dermatomal pain is present but there is no skin lesions, then this condition is known as zoster sine herpeti. Now, what are the complications? So, the most common complication is post herpetic neuralgia. Here, there will be still pain at the local site. Now, the next complication is zoster ophthalmicus. This is the involvement of trigeminal ganglia, and the dendritic ulcers will be present. Now the next complication is the famous Ramsay-Hunt syndrome, which has involvement of the geniculate ganglion of seventh nerve. It has triad of 3, which has the first facial nerve palsy, second is vesicles at external auditory images, otalgia, loss of taste sensation in anterior two-third of tongue. Now what are the vaccine of shingles? So we have two vaccines. First is live attenuated vaccine, that is ZOSTA-Vex. Out of its name, herpes zoster. So ZOSTA and Vex. ZOSTA-Vex. And the second one is a recombinant vaccine called Shingrix out of shingles. Thanks for watching. Don't forget to like and subscribe and share with your friends.